I'd love for you to talk a little bit, Dr. Rolfo, about some of the challenges related to appropriate access to lung cancer care as it relates to different socio-demographic populations. And then how can we begin to address those disparities?
Yeah, this is a topic that is really in my heart because, as I was commenting with you before we start the communication, the recording of this, I was working in Europe before and coming to United States. I was shocked in the kind of disparities that we see in some healthcare situations. So, you know, in my position before in Europe, we have a healthcare system that is covering for patients, and we have obviously difficulties. But here I saw in some communities really underserved in terms of access to different service, and healthcare is one of them. So we need to be conscious about that. We have patients that are struggling to get transportation. We have patients that are struggling to get approval for some drugs. So there is a lot of areas that need to be addressed. Disparity also in terms of language. We have also patients that are not understanding the doctors. So we have patients that are having difficulty even to get to the app informations when we are saying, oh, you can see your report in your app. So it's not easy for some of them. We have generational gaps as well, that these are disparity as well. So taking or being conscious of all these factors are making us to take actions. And how we can take actions in our institutions and in several institutions in the country, we have the support of an experienced team that is addressing that, and teams specific that are working for disparities. Some of them are social workers, some of them are advocate patients. So we have a big team of in institutions that are helping to the patients to go for different scenarios, and even we have patients that are homeless. So how we treat patients in these conditions when we know that the patient is in a shelter. So if he have a toxicity, what we will do it. So all these things are taken in consideration, believe me, because in cities like New York, you have a big disparity of, or a big diversity, I will say, of populations. In one consultation morning, you can see all of them in your waiting room. So we need to try to address all these. And there are politics that are coming from us as a healthcare system, but there are also politics that they need to come from governmental politics. So try to use all the tools that we have in our disposal is important. And also we have a very good support of advocacy groups. And this is something that I want to really profit the occasion to say thanks, because we have several advocacy groups that are doing a terrific job, from testing to helping patients to go through this journey. So it's really an important job. And obviously families are helping to these disparities, and patients. So patients themselves. So what I say always to the patient, raise your voice, empower yourself, try to ask for your rights. If you don't understand your doctor, ask again. If you want to have a second opinion, tell to your doctor. That is the most important thing. We are very open to help the patients, and that is our mission. So if I say to my patient, if you want to have a second opinion, please let me know, and I try to direct you to somebody who is an expert in the field and can help us to learn better your disease or your treatment. So I think it's a situation that everyone is winning, especially the patient, but also us for future patients understanding better every case.